Good afternoon. This is Scott McGann from the Falmouth Health Department doing Falmouth's weekly COVID-19 update, today being October 30th, 2020. falmouthmass.us is our website, health@falmouthma.gov is our email, and 508-495-7485 is our direct line. So as of today, we hit 300. So we're at 301 cases since the beginning. And there have been 10 confirmed cases this past week. Actually, a few of them just popped in today. We were at a pretty good pace, right around that 5, but we did have several pop in today. So for the past week, we have about 10 confirmed cases. No longer in isolation, has always been around 95, 96, 97%. And we're still right around that same expectation that we would have about 14, 15% of the cases. Of course, VNA and the CTC at the state will continue to do the contact tracing. Looking at our weekly output, we've had less than 10 for the vast majority of weeks since the end of May. We're at 10 this week, so we're on the higher side. The previous 2 weeks were at 5 and 4, which was 9 for a 2-week stand, and we'll talk about that in a second. With our highest being, again, with the lifeguard and the nursing facility in the same week, we had an increase of 15 that week. But we're still right around that 10. Looking at it overall, we're sort of in the same. Again, real fast increase back early on, and a couple of balloonings through long-term care, lifeguards, different situations, and we've been on sort of steady and in pretty good shape for most of the summer and most of the fall. That being said, look at the state map. So this map comes out every Thursday. It used to be Wednesdays, and if you've heard this previously, it was always Wednesdays. It now comes out about 6 o'clock on Thursdays, and you can see a lot more red. So red is still a relatively low number. It's less than 8 cases per 100,000, 8 cases per 100,000, so it depends each time. So right at 8 versus, let's say, 30, there's a big difference. So anything greater than 8 is considered red. You can see that the Cape had a couple of towns turn yellow. Again, with us having 10, I think it's somewhere around 18 over a 2-week span would get us into yellow. Right now we're in the green, and that data comes from the week of the 11th through the 24th. So there's a delay in this in the color change based on your 2 previous weeks prior to that Thursday. You can also see where you see some asterisks. The asterisks represent either more than 10 confirmed cases in the last 14 days or 30% of total number of cases in the last 14 days linked to a congregate care. Could be an Institute of Higher Learning, long-term care facility, or a correction facility. So you can see that some of the asterisks might be. So if we turned red with an asterisk, it would probably be more likely than not the long-term care hit, which I hope we don't have. So you can see there's a lot more red, and you've probably heard on the news that we're having an increase throughout the state. As of now, we're not at that point, although today we had some cases come in, so I don't know if that's just going to level off or what's going to necessarily happen with it. The daily rate for the state is 9.2 per 100,000, so that's well over what we'd like to see. Falmouth specifically, the bottom, the 1029 at the top chart shows that this was done on Thursday, the 296. We had 10 cases for the 2 weeks, which was 2.3, right around the same as the 2.1 the previous week before. We had 2320 for the number of tests, and we've been averaging right around 11 to 1,200 tests per week. I circled percent positivity to give you a perspective. Obviously, the more you test, you'll tend to find more asymptomatic. So you see 0.36 and 0.47 as our last 4-week positivity rate. When we were in the gray earlier, late August, early September, around Labor Day, we were right around that similar percentage of 0.31 and 0.35, but we were in the gray with less than 5 cases, and it's got to do with the quantity of tests. We're testing about 1,000 more tests every 2 weeks than we were. So you'll have a few more cases, but your positivity not necessarily goes up much because of that. So that's a good positivity rate. You got to keep it less than 1 is a wonderful number. And so that's where we were for those 2 previous weeks, though we've had, again, with some cases that we've had pop in last night. So let's just hope that sort of flattens back out. Otherwise, if you're going 5 or 10 every couple of days, then you're going to be in the yellow or the red. So hopefully that was just something that just happened and is going to go take care of itself. Barnstable County has had a 3.3. They're doing about 12,000 tests per those 14-day time frame. Their positivity rate was 0.94, so we did better than the county in these last couple of weeks. The state has not been doing so nearly as well. As you can see down the bottom, they went from 8.7 to 9.2 to 11.8 per 100,000. And then their positivity is at 1.5 to 2. 2 is definitely, you have to be less than 2. You need to keep it less than 2. And so the state is not doing as well. Of course, you can see from the chart and also from this that we're still holding our own, at least from this point in time, which would have been Thursday, yesterday, is data. Good news would be, like, if you look at this left-hand chart, you can see that we're darker. That darker means that we've had a robust amount of tests. And our positivity is light, which is the right-hand chart, shows that we've got a low positivity rate. So that's good. You always want the left hand to be dark and the right hand to be light. And, we maintain that. Whether it's going to stay there or not, I don't know. Barnstable County, you can see that we've, since about September, has been single digits, then in the low teens, back to single digits. You see 26 and 24, there was a cluster associated with a church going on Mid-Cape. I think it had a lot to do with some of these numbers being high. Last couple of days, we've had 8 and 5. So hopefully we maintain, again, less than that, in that 10 single digits for the entire county with over 200,000 people in it is a pretty good number. I just don't know whether it can stay because, again, going back up to the chart, we're not an isolated population. There's going to be some flow back and forth with different things, especially with the holidays coming up. So we'll talk about that in a second. Barnstable County, again, for the day was 5. They have 2,004 positive. These are confirmed. So Barnstable County went over 2,000. There was no deaths associated for that particular, for this particular day, which would be Thursday the 29th. This is the state's dashboard. This is the daily dashboard. The numbers over the last week have been over 1,000 per day, and the deaths have been somewhere in the mid, I've seen as low as 7, as up to 27. The metrics that we use hasn't changed yet, so we haven't gone yellow with hospitalizations yet, which we maintain green. Our test rate is still green, but if this trend continues, we'd probably jump to yellow in some of these. New individuals tested on the particular day, it was over 18,000. That's new individuals. We're over 5 million total, 5.9, pushing 6 million total tests, with the total deaths 97.27. So the numbers are higher in terms, and it's mostly the grouping that is mostly testing positive. Governor Baker mentioned it on his press conference, I believe, this morning, is that it's under the age 30 group is generally having the most number of cases. Positivity, we're way higher than the 0.8. We're at 1.8, which is 138% higher than what the lowest number that we had. Again, I always said that this is an important number. The state needs to keep this down as much as possible. Hospitalizations has been on a little bit of an upward swing. 500 and 400 to 500 was our number in early October. Low 400s in mid-September into early October, but now we're into the mid, at least the mid, maybe even slightly higher mid, 500 number. Okay. And deaths have been staying in that teens, a little high into the 20s, 21 now, so they can see things sort of creeping up. Hospitalizations are higher than they were last week, up 186 total from September 25th, down a total of 325 from June 26th. Good news is that our hospitals have been doing well. We have not had a lot of hospitalizations, which is indicating of having a lot of the cases be of younger people. Under 70 or under 60, so we do maintain good in our hospitalizations and ICUs between Cape Cod and Falmouth Hospital. Intubations and ICUs are up 30 from September, down about 100 from mid-June. We're up 12 from September 25th on the intubations, which means the vent. And so you can you can get this every day after 4 o'clock on the state's website. Long-term care facilities, 6,390 total number of deaths, up from 6,314, and cases are also up by several hundred. So, some of these are still, some long-term care facilities are still getting outbreaks, and there's still deaths associated with, although the ones here in Falmouth have been doing quite well. They have been doing quite well for some time, knock on wood. A little bit about COVID testing. Nothing's unchanged about COVID testing. It's still at Falmouth Hospital by appointment. And your physician will determine the need for a test. You call the physician will calls that and gets a test. Tests are pretty easy to get. Some of the pediatricians' offices are starting to get in some rapid tests, PCR tests as well. You also can get it at East Falmouth CVS. The walk-in clinics like Convenient MD, the Community Health Center of Mashpee, of Cape Cod and Mashpee, also as well. Types of COVID tests, again, this is an unchanged. PCR is still the gold standard. It's still taking greater than 24 hours to several days. That's the only way to get confirmed. There is the antigen testing, which is rapid but less accurate. There's one place in Dennis, the Caremark in Dennis, that offers that. Antibodies are just telling you that you've had a past infection and not really very useful for us in the contact tracing purposes. But PCR and antigen, we do contact tracing on. And PCRs are getting, rapid test methods are on the way. I mean, they're not going to be here too much longer. We're saliva-based and different rapid PCR tests. We did some. We had a company that offered some free testing at the schools, and we offered it to the staff. And the staff basically, it was a saliva test mailed out, FedExed overnight, detects viral DNA, and you get your results. So there's some different types of tests out there. It's not quite FDA approved, and I think maybe they're working on getting FDA approval and needed a lot of tests done. So that sort of stuff is on we're on the sort of the cusp of getting more rapid tests in, other than just that more slowly PCR to a lab type of test. You know. So hopefully we get to a point where we have rapid, cheap, and accurate testing. In terms of flu shots, we had our flu clinic this past Monday. It went fairly well. We did about 200 people. If you still need a flu shot, Convenient MD, CVS, Walgreens, Shaw's, Stop and Shop, Dr. Lee, your physician, your pediatrician is where you want to go. At this point in time, I don't have another flu clinic planned. We used up our allotment that we have through the VNA. But if you do need, especially we do have some shots available for uninsured children under the age of 18, you can contact us and maybe we can work on something for you on that. We're in phase 3, step 2. Some high-risk communities have been moved to step 1. Revised gatherings order and everything has not changed in that sort of sense. Ice rinks, I mentioned last week, were closed from the 23rd to the 7th due to some clusters, over 100 cases linked to about 30 clusters. That remains. I don't know if the governor's going to lift that on November 7th or not. It's going to depend on him and his staff. As far as social distancing, this slide's been up a lot. Of course, last thing we want to do is undo the hard work that's been done. Interestingly, the state of Rhode Island, I happened to be listening to the governor's press conference. I had the radio on and she was speaking, that in schools they have about 100,000 students that are in person or sort of a hybrid or in person, and 50,000 students that are fully remote. And there's been about 130 to 150 cases in the state of those that are of the 100,000 that are in person. And there's been double or 350, more than double, cases associated with the 50,000 kids that are remote. So it does seem to appear that the social distancing and the processes in the schools are effective. That there was much more likelihood, at least in the first 7 weeks in the state of Rhode Island anyway, that remote learning, so people getting it from other avenues. So if they weren't in school, there was other things, other activities, or other things going on, getting together, gathering, so forth, that lend itself to having more cases associated with a remote, which I found was to be interesting. So again, good procedures following social distancing and masking definitely seem to be effective. It's been working. And so we definitely want to continue. It's going to be more and more important as we get into the winter months and we start traveling for holidays and so forth. So again, the last thing we want to do is undo the hard work that's been done. Trick-or-treating, we put out a do's and don'ts for trick-or-treating. Enjoy Halloween outside rather than attending indoor events. So the main thing is it's the costume parties held indoors, the Halloween parties after it. My family always has a large Halloween party before, and we have kids over after. We're not doing that this year. It's the indoors are much more problematic. Do not trick-or-treat if you feel unwell or you're tested positive or you're in quarantine. So as far as Halloween, enjoy it outside. You can place, if you're somebody who's going to be putting out candy, you could place it on a platter for a grab and go, so you're not necessarily opening the door and interacting. If you're trick-or-treating, carry hand sanitizer. Maintain social distancing whenever possible, small groups of family members only. If 30 kids are running around together, even outside, they could be spreading it. The face mask that you might be wearing on your costume is not going to count, so let's wear a real face mask. Maybe make it integral into the costume. So a costume mask is not a substitute for a face mask. So that's sort of the trick or treats. That's on our website, on the town's COVID website. We have that up. So in terms of a recap, the state's metrics are definitely on an increase. Now, it's not quite the same. 1,500 cases today isn't necessarily quite the same. I just wanted to mention that maybe perhaps May was or April. Back when we didn't have a lot of tests, we were generally testing only symptomatic people. Nowadays, when it's the same 1,500 that test, you'd be getting a certain percentage of those being asymptomatic because they're being tested for their jobs or for other purposes. So the good news is that, you know, we probably, when we had 1,500 a day positive in the state in, let's say, April 15th or some date, that there generally probably was a far greater number of asymptomatic, where now we're catching some of the asymptomatic in the same 1,500. But still, the cases are on the increase, and they just haven't necessarily hit us yet. There's always, you know, the possibility for that to happen. Yeah, I may be coming to you next week to say that we're at 20 or we're at 12, or we could be at 2. It all depends on the individuals that are following the guidance and not doing the gatherings and getting together and having the parties or whatever they happen to be doing. I know it's hard, but that's what works. So our current level of mass here in Falmouth would be phase 3, step 2. That has not changed. That could change. I mean, if we went red, that'll change. We'd go down to step 1, and that would change the gatherings orders and a few other things. So again, stay the course like we've always been, and next week I'll do another update. Thank you.